I'm curious your take on what the best way is to go about distributing these initial vaccine doses.
There's been a lot of debate about this amongst ethicists, and they've come up with this idea of what's called the fair allocation principle. And the idea is that first you should allocate on the basis of life or the ability to save lives. So that's people who are at threat or healthcare workers. And then secondly, you should allocate on the basis of people whose economic ability to make a living for themselves is harmed. So that's really essential workers. And then finally, you should allocate on the basis of lifestyle. So that's sort of people can go about their normal business. So that's most people, like I guess you and I in that case. So that seems to be a kind of fair principle which will both benefit not just the most vulnerable in our society, but it will also benefit the economy as a whole.
And Professor, the next challenge here, beyond actually manufacturing, securing, and distributing the vaccines, making them available, is getting people to take the vaccine. And this point was emphasized last week by UK leadership. How do you increase uptake? And I was reading an interesting piece over the weekend from behavioral scientists suggesting that we could employ similar tactics to what we see when it comes to voting to get people to get out and vote. So things like encouraging people to post on social media after they have voted. Do you think methods like this could encourage the same type of behavior? If people see others getting vaccinated, that will spur them to actually go for the inoculation as well?
Sure. So this is a huge issue. We know that anti-vaccination sort of rhetoric is increasing, and particularly during the kind of COVID upswing. So I got a newspaper through my door the other day sort of saying that this is all of a hoax. Now, the typical way in which people respond to this is to provide information saying it's safe, and you might also get leaders or other sort of influential people in a community to be seen taking the vaccine. Those are the typical ways. But there's a lot of research to suggest that that does not tend to convince the most uncertain. So what you need to do with them is to focus on people they actually know. So in some cases, people are sitting on the fence. It's actually a family doctor or a trusted nurse who's going to be the most likely to be able to convince them. For those people who are actually against it, instead of saying you should take the vaccine and taking this kind of very confrontational approach, it's better to start by opening up a conversation, and that conversation should be opened by a family health care provider rather than some sort of distant expert or politician or celebrity. So once you open up a conversation, you can ask them, what are your concerns? And then that healthcare practitioner can actually work through it and address it. And then many of those people will end up taking the vaccine. So you're only left with a very small, hard core of people who have rather deluded ideas about the vaccine.
And obviously that's going to be a function of time. I guess the more people take it, the more other people are going to want to take the vaccination as well. I just want to turn your attention back to one of the other challenges, that is the logistical challenge. And when we were talking about the rollout prioritization, we said that it would start with the elderly and possibly people living in care homes. But many of these people live in remote parts of the country. How much of a logistical challenge is it going to be to actually get the vaccinations there in a pristine condition? I.e., could we end up in a situation where the vaccine makes it to the care home, but may have been damaged in the process because it wasn't stored at the right temperature?
Indeed. So we have to remember that there are different types of vaccines. So the BioNTech, Pfizer one, and the other one, the first two which were out came with RNA, and they need to be they're required to be stored at a very low temperature. So I think it's -70, and that requires a very kind of complex logistical chain, whereas the Oxford University one, AstraZeneca one, that is required to be stored at a higher temperature. I think it's just below freezing. So that one should be a lot easier to distribute both in developed countries but also in developing countries. Then the question is, once it gets to the care homes and so forth, it has to be handled and kept at the right temperature. There's actually a lot of research to show that nurses are a really important part of this. So actually having skilled, trained nursing practitioners are an important part of actually preserving the vaccine at the right temperature. And then the last step, and actually this is really interesting, is the actual administration of the vaccine. And if you actually talk with healthcare practitioners, and particularly nurses, they note that actually administering vaccines, particularly in large quantities, is actually a pretty boring difficult and emotionally challenging job, and the longer you spend administering the vaccines, the more scope there is for mistakes to be made. And also, we should remember that there's quite a few, well, not quite a few, but there's a percentage of healthcare practitioners who are actually skeptical about the vaccine because they say, well, it hasn't been, there's not been that much trials being done on it. We've seen this before with complications in the future. So I wonder whether this is really going to work out. So there needs to be a kind of a sales job, not just for the public, but also for those practitioners.